Welcome to On the Beat, everyone. I'm over here with Dr. Richard Hurd and, of course, Dr. Ricky Johnston from Gastroenterology Associates of Columbus. And today we're talking about a topic that no one likes to talk about. And, of course, it is hemorrhoids. Welcome to the show, my friends.
Thank you.
Thanks. Okay, again, it's a topic that not only men don't like to talk about, women don't like to talk about it either, because it's a very discomforting conversation and also can create quite a bit of pain within someone's body. So let's discuss it to begin with. What is hemorrhoids?
So hemorrhoids, everybody is born with. So people sometimes question whether they have them or not. Yeah, it's part of our basic human anatomy. Everybody has this little plexus of veins that occur in the rectum just above the anus. Not always prevalent or causing symptoms, but in some people they can get engorged or swollen, and that's when we start to see them causing problems. And they can occur on the inside and on the outside. So there's internal hemorrhoids, and then there's also external hemorrhoids.
Okay, so when we have an image of a hemorrhoid, in my head, I'm thinking it's like golf balls, but you're saying like a vein. Well, I'm thinking round, sort of like blisters and things like that, or a muscle. But you're saying it's a vein.
Correct.
And how big does that get? They can be quite...
Well, I mean, in some people they can be really big, but the caveat to that is they don't have to be very big to cause lots of symptoms.
Really?
Yeah.
Okay, well, what causes them?
A lot of things. And the viewing audience is welcome for all these images we have in their head right now. But, mostly lifestyle stuff. So people who have constipation, we talked about irritable bowel syndrome in a prior segment. People who have constipation chronically and are straining to go can cause these veins to become swollen.
Pregnancy is another big one.
Pregnancy is a huge one, and we see that all the time. Those are the
lifestyle
main factors. Yeah.
Okay, genetics?
Not so much. I mean, I wouldn't think that would have much play here.
Why is there an issue with pregnancy? Not an issue, but a cause of.
It just increases the pelvic pressure because you're carrying so much abnormal, weight and contents down there. It increases the rectal pressure.
We were lost for words, and I agree. Yeah. I wasn't quite sure what I was going to say either. Let's talk a little bit about what you can do to fix them.
Yeah, mainly we try to do conservative things like change diet, increase fiber in our diet, makes you go
more natural to begin with.
Sure, makes you go more regularly and not strain. The other thing we try to teach people is not to take a book into the bathroom with them. Don't take their phone in there. That time.
Why is that?
That time sitting is your musculature is relaxed and it allows things to become more swollen there. So you want to get in, get out. 2 minutes is what we recommend to people on the pot, off the pot.
I understand. I always thought that it was better to be more of a relaxed state when doing that.
Certainly you do, but if you're there for longer than 2 minutes, we tell people pack your things up and come back another time when you have the urge. We don't want you sitting there all day.
Okay, all right. Well, what are the treatments?
So we talked about conservative management, which helps a lot of people, surprisingly.
But let's talk medical
treatments. If we get beyond the conservative things, then there's creams and suppositories that may help some people, and we'll do trials of those. But beyond that, in the past, historically, a lot of people have had to go for surgery to have a surgical hemorrhoidectomy, which can be quite discomforting. There's complications associated with that. I don't think I've talked to a single patient who's had that done who would like to have it done again. So there's newer treatments that we are actually performing now that we actually put a rubber band just inside the rectum on the internal hemorrhoids. It's painless, it's all outpatient, there's no prep, there's no sedation, it's done in the office, and it's highly effective.
When we go into the medical procedures, is that all covered by insurance?
It varies, as with anything else. Some insurances will cover more than others.
We appreciate you guys, as always, good information, and we tackle the topics you don't want to talk about.
It's tough, yeah.
Appreciate it. If you want to find out more about Dr. Richard Hurd and, of course, Dr. Ricky Johnston, there's all their information up on the screen. We'll be back after this short break.